Hi, my name is Princess Sanders, and I am an LPN to RN BSN student at Indiana State University. Today, I would like to talk about caring for the LGBT community, nursing care that is rendered unbiasedly and respectively. Before we get started, please take time to take the pre-test prior to reviewing this presentation. The learning objectives for this presentation are the following. The viewer will categorize the LGBT community by title. The viewer will list the risk factors within the LGBT community. The viewer will list the way care differs within the LGBT community. The viewer will list the responsibilities of the healthcare professional. The viewer will recognize suggestions to protect and respect the LGBT patient identity. The viewer will compare and contrast the LGBT patient responses based on the nurse-patient relationship. And the viewer will describe the Healthy People 2020 objective relating to the LGBT community. Let's discuss what LGBT stands for. An individual's sexual identity and/or orientation is what encompasses the title. The L stands for lesbian, G stands for gay, B stands for bisexual, and T stands for transgender. There are some risk factors associated with the LGBT community. Homelessness, suicide. The LGBT community is also low in seeking preventive service for cancer. They have an increased risk for STDs, an increased risk for mental health issues, an increased risk for isolation, and also drug use abuse. Here we will discuss how the care of an LGBT community member differs. First, we would like to take a look at the patient resistance. Patient resistance appears because of fear of judgment from others, including the healthcare provider. The nurse or the healthcare provider also encompasses a lack of self-recognition for improper behaviors modeled by the healthcare professional. Sometimes we as healthcare professionals don't notice our improper responses. Also, the patient preference falls outside of societal norms, meaning their sexual orientation or who they choose to identify as is sometimes something that we're not used to. Because of these reasons mentioned, care happens to differ for the LGBT community, and it should not. Keep in mind that fear and trust has a big impact on the balance of care. The more fear the patient has, the more trust is eliminated. We want to make sure the patient trusts the healthcare provider and the nurses that are caring for them. So because we know that care can alter due to the reasons mentioned in the slide before, we as healthcare professionals have a responsibility to the LGBT patient. First, we need to understand our stance and face them. We need to know what we believe in, understand our values, face them head on in order to hear and care for the patient. We need to avoid assumptions. We need to request gender identity from the patient and the name preference that the patient would prefer. Would the patient like to go by a male or a female? Would the patient prefer a name that's outside of the name on the driver's license that will match the patient's preference and identity? These are things that we must know as healthcare professionals in order to respect the patient. We need to request assistance with care from the patient when needed. Also, request the patient to voice patient preference. What does the patient prefer? Avoid facial expressions and any other nonverbal body language. A lot of communication is nonverbal, and we must keep this in mind. We must develop a trusting relationship with the patient. Remember, increased trust means decreased fears. And we must also express and confirm the number one priority to the patient, and that is the patient. Also, a responsibility of the healthcare professional is technology accountability. Here is a suggestion suggested by Frangella, Otero, and Luna in 2018 for a three-step health information management identifier. First, we must request information. We need to know what the gender at birth was, and we also need to know what the gender identification is. This may be two different things for the patient. We also need to store information. Again, we need to know what the gender at birth was and document that. We need to know what the gender preference is, document that. And we also need to know the legal gender. All three may be different or all three may be the same, but it's important to understand and document this information. Both the information requested and the information stored must lead to information transparency. So, in order to respect the patient's preference, we would, after determining what the patient would prefer to be called, document the name and pronoun preference in the header of the patient's information. Does the patient want to be referred as he or she? These are very important and should be documented in the header. Also, an alert icon for different birth or legal gender, meaning something that signifies to the provider or the person documenting care for the patient that there is something more to review. This is very important. It should be something that we incorporate in the patient's medical records. Let's talk about the patient's response. It is very important to have a positive nurse-to-patient relationship. Here is some reasons why. When there is a positive nurse-to-patient relationship, full disclosure of accurate medical history will be offered by the patient. Also, the patient will have a willingness to express a change in mental status. If they are thinking about suicide, as long as there is a positive nurse to patient relationship, there's a high chance that that patient may let you know. The patient also has a willingness to provide concerns to the provider. There is a disclosure of lifestyle and risky behavior and a confident, more comfortable measure of exposing that information. Also, the patient is willing to receive promotional and prevention advice. All great things. But if there is a negative nurse to patient relationship, some of the following will ensue. A fear of judgment by the patient may occur, which will lead to the patient not being upfront and unwilling to disclose information. This includes behavioral practices. Also, the patient will have a lack of transparency. They'll feel guarded and not want to express to you how they truly feel. The nurse will also have an inability to step in. If the patient is guarded and is not open to expressing their fears or describing their history or current behaviors, then the nurse has no opportunity to step in. It is evident that we need to, as nurses, streamline care for the LGBT community. For that reason, Healthy People 2020 decided to create an objective for this community. The goal is to healthy improvement for the LGBT community, where there is also evidence-based research topic areas to enhance care for this community. Those areas are mental disorders, substance abuse, and knowledge-based fundamentals. We need to address this community and address them appropriately and respectfully. Thank you so much for your willingness to determine how we can increase the care for the LGBT community. Don't forget to take that post test and also review resources available to help in caring for the LGBT community. Thank you so much for your time and have a wonderful day.